I think I always knew I wanted to be a nurse. So I enrolled at age 18 at New Mexico State University in their nursing program. I've been a nurse for over 40 years now. So when I graduated from nursing school, I was very young. I was 22 years old. My very first job was at night because I was pregnant. So I was working night shift on the telemetry unit. And I thought this is fun, but then I knew I wanted to do more. So from the telemetry unit, I worked in the emergency room, and then I worked in intensive care. But with my husband being in the Navy, it was very difficult to try to juggle a child and everything else that you had to do. That's why I was looking for something a little bit different. So I went and interviewed for this home infusion position. And I was like, what is home infusion all about? And they started telling me, I was like, oh, this kind of sounds kind of cool. I think that would be fun. Having that strong critical care background with ER background made me think very, very quickly on my feet. So I had that experience behind me where I was very comfortable in my decision making with those patients because I was the only one there taking care of them. I think I liked the aspect of we could do anything. Maybe it's a cardiac drug that was giving an end-stage, heart failure patient a chance to be on medicines at home that typically would only be administered in the ICU or in the hospital under monitoring. But that was something that we could then do at home, and just being able to take care of them and give them that extra life that they deserved, I think is what I loved the most. And then just that networking. Even if you were a competitor with another company, we were all friends, and we're still friends, still to this day. We've all been working in this industry for a long time, but you would just bounce things off of something, just, hey, have you ever thought of doing this? So it was very collaborative, not only within the organization that you worked for, but with outside folks too. My very best friend, Mary Cope, she was a pharmacist and I'm the registered nurse. So we were working for that company, and that company was going to be sold. And we were like, we think we can do this on our own. So we did everything you're not supposed to do. We raised $500,000 worth of capital from moms, dads, brothers, sisters, aunts, and uncles. Started Home Choice Partners in 1996. We were like, we can do this. We can service the community. We can give back to the community. There are patients that don't have money. They're not on Medicare. They don't have private health insurance, but we could help them. We figured out a way to do that. So once we sold Home Choice to a very large national company in 2013, I did stay on for 2 years. I was their VP of Clinical Operations, and I just got to the point where it wasn't the same. And at that point, Smiths Medical reached out to me, which was a manufacturer of pumps and other items, and said, would you be interested in joining our team? We really need someone with home infusion experience like yours. And I was like, I can, let me talk to my husband about that. Let's see. And I do not regret it at all. What I like the most about it is I'm still networked in. I'm still working with those home infusion providers, and I feel like I truly still make a difference. It's definitely a different role, but I love it. I love being on the outskirts. I feel like I still have a lot to give, and I continue to learn, as well. When I went into nursing, I wanted to help people, and I think I'm still doing that. Trying to push our industry forward, it is helping that patient. I've been on the INS board, I've been on the INCC board, I've been on the Specialty Pharmacy Certification Board, which I'm still on. I volunteered, with NHIA as well. I've done, speaking roundtables and that kind of stuff. It's just really being involved, making a difference. The older I get, the more I realize, I'm gonna be that patient one day. So hopefully I've made some impact along the way where we are providing excellent care at home. The youngest patient we ever had on our service was 1 day old. The oldest we had was 106. Home infusion really has that skill set from pediatrics all the way through older adults that allows you to practice, nursing, pharmacy, nutrition, anything. It offers everything.